From KETK, you're watching East Texas Live.
Hey there, welcome back to East Texas Live on KETK. Joining us now is Dr. Jon-Michael Cline with Azalea Orthopedics. Now, what's your specialty at Azalea?
Thanks for having me. My specialty is non-surgical sports medicine.
So can you tell us more about non-surgical sports medicine? What is that, just a bunch of stretching or?
A little bit of stretching, but the main premise behind what I do is I'll see athletes of any age, so age 2 to age 100 even, and our goal is to get patients in, make an accurate diagnosis, and get them back on the field to do what they enjoy doing as soon as possible.
So what all do these treatments entail? Do you like pop joints like a chiropractor? You have them on some treadmill machine? Like, what are non-surgical treatments?
So I do a lot of casting, do a lot of splinting, a lot of concussion evaluations. We also do injections. Many of those injections are guided with an ultrasound machine to make sure that they hit the right spot.
Oh, like the guy when Troy Aikman had to have the cortisone in his back or whatever it's called? That was something you did?
It's not something I did.
Well, for Troy, but yeah.
Potentially it could have been done that way.
All right, so when we're seeing all these kids getting hurt, is there anything that you would recommend that they do to minimize these injuries?
Well, you know, one thing is that they can stretch. So there's good evidence-based research behind stretching. So that's one thing. But the other thing, you can't always predict these injuries. So you know, we never want athletes in our community to get hurt, but when they do, we're there to take care of them.
Well, let's talk about the new technology that you guys use. You said y'all have ultrasound to guide the injections now. Is that new?
That's been around for a while. You know, it's the same technology that they've used to, you know, surveil babies for years, but now we're using it more and more in musculoskeletal medicine. We can use it to diagnose injuries. We don't always have to get an MRI for certain injuries, but we also use it to guide our injections and do procedures with.
So in your specialty at Azalea Orthopedics, what else is going on that people need to know about? Like, if there's like a secret that you just wish you could get to the general public.
A secret. Well, there's a lot of new things that are coming out right now, James. Probably the newest one that we're doing is a procedure called TinJet, where we use the ultrasound machine and we guide that needle into a spot of tissue injury, and we use a high pressure water pick to basically heal that tissue. Oh,
right, like the dentist setup, the water pick.
Similar to how the dentist setup is, yeah.
Okay, so how serious are you about, for people, if they have an injury, not delaying getting help for it because it'll only get worse? Like, everyone knows that, but from a doctor, it means more coming from you.
Well, from a doctor's standpoint, we want to see you as soon as possible so we can get you on a treatment plan quickly and not let those injuries kind of go, because the longer they go, they can be harder to treat.
Yeah, did you hear that, Mom? You should have gone in a couple years ago. She went through Azalea Orthopedics. They were great for her. All right, well, thank you, Dr. Cline. We hope to have you back soon.
Thank you for having me.
If you need more info, azaleaortho.com, azaleaortho.com. We'll be right back with more East Texas Live.